I see many folks are still joining, we'll just wait another minute. Thank you.
Hello, and welcome to our webinar titled HIV Challenge, Seeking Innovative Community Engagement Strategies to Reduce HIV-Related Stigma and Disparities. Bienvenidos todos. I'm Rear Admiral Felicia Collins, and I have the honor of serving as the Deputy Assistant Secretary for Minority Health within the U.S. Department of Health and Human Services, or HHS. I also serve as the director of the HHS Office of Minority Health. The HHS Office of Minority Health is thrilled to partner with our colleagues from the HHS Office of the Assistant Secretary for Health's Office of Infectious Disease and HIV/AIDS Policy on this national competition to reduce HIV-related stigma and increase prevention and treatment. I'm also pleased to be here today with my colleagues from the HHS Office of Infectious Disease and HIV Policy to discuss our HIV challenge, which addresses an important public health issue that affects racial and ethnic minority individuals who are at increased risk of HIV or are people with HIV. At the HHS Office of Minority Health, our mission is to support efforts that improve the health of racial and ethnic minority populations through the development of health policies and programs that help eliminate health disparities. The Office of Minority Health team has a collective goal of the success, sustainability, and spread of health equity producing policies, programs, and practices, which we fondly call SQPQ. Promoting the sustainability and spread of successful health policies, programs, and practices to end the HIV epidemic is a priority for the HHS Office of Minority Health and a priority across HHS. And we know it will require federal, state, and local partnerships to both envision the development of innovative practices and to make those practices a reality within and across our communities. It's also clear that trusted community messengers, individuals and organizations respected within their local communities, are essential partners in this effort, as these community messengers can both develop novel and innovative approaches, as well as successfully implement the related activities within their communities. Thus, our HIV Challenge supports efforts of these trusted messengers who will develop and test approaches to reduce HIV-related stigma and increase the use of prevention and treatment options to ultimately decrease HIV-related inequities among racial and ethnic minority populations nationally. This HIV Challenge puts into action recommendations from our Advisory Committee on Minority Health, which calls for new and innovative strategies to engage communities with significant numbers of new HIV infections and to reduce stigma and discrimination for individuals from racial and ethnic minority populations in order to maximize HIV prevention, diagnosis, and treatment. The HIV Challenge also aligns with other activities within the HHS Office of Infectious Disease and HIV/AIDS Policy to increase community engagement and reduce stigma in order to reduce HIV incidence in groups that have been marginalized. This is why we are delighted that you've joined us today, and we encourage you to apply for and participate in this HIV challenge, which, by the way, is the first bilingual challenge posted on challenge.gov. In fact, we encourage you to not only submit your ideas and take part in the challenge, but please help us spread the word with your networks and communities regarding this opportunity to develop and test approaches to reduce HIV-related stigma and increase the use of prevention and treatment options among racial and ethnic minority populations. Thank you so very much for your time and attention today. Muchas gracias. It's now my pleasure to introduce my colleague, Ms. Kay Hayes, the Acting Director of the HHS Office of Infectious Disease and HIV/AIDS Policy within the Office of the Assistant Secretary for Health. Kay also serves as the Executive Director of the Presidential Advisory Committee on HIV/AIDS. Take it away, Kay.
Thank you so much, Rear Admiral Felicia Collins, for your kind introduction, and good afternoon, everyone. As Rear Admiral Collins mentioned, I am Kay Hayes, the Acting Director of the Office of Infectious Disease and HIV/AIDS Policy, and also the Executive Director for the Presidential Advisory Council on HIV/AIDS, PACHA. I am truly proud of our partnership, and we are both grateful to have the full support of our fearless leader, Dr. Rachel Levine, Assistant Secretary for Health. As Rear Admiral Collins explained, this challenge provides a real opportunity for individuals and organizations on the ground to participate in developing approaches that can be successfully implemented within their communities. So why is this important? We know that there are barriers around access, stigma, and outreach. But we also know that there is not a one-size-fits-all solution. What works in Alabama is not going to work in San Juan or Washington, D.C. It is a fact that the theme we had a PACHA meeting very recently, and it's a community mantra, nothing for us without us. And we will not end the HIV epidemic by leaving some communities behind. During the same PACHA meeting we held in early August, the HIV challenge was referenced and recognized for being designed to bring diverse voices to our federal HIV response to really effectively end the HIV epidemic. Let me share a little bit about what our work in ending the HIV epidemic looks like. For those of you that are familiar with PACHA, you know that ending the HIV epidemic in the U.S. initiative has been one of their main areas of focus. EHE remains an absolute priority for the Biden-Harris administration, and OIDP continues to provide leadership and support for EHE, working with our federal and community partners. This is a critical time now that EHE has been operating for about 2 years. We have a real opportunity to do some reflection and possibly make refinement, if warranted, to continue to enhance our efforts. The EHE initiative will continue to be a leading component of our work to implement the HIV National Strategic Plan. This effort is being led by our dear friend, Harold Phillips, who recently was appointed to direct the White House Office of National HIV/AIDS Policy, and in partnership with OIDP under the leadership of Dr. Tim Harrison. It is my continued pleasure to work closely with Harold and Tim, my extended family. And I thank you both for your leadership, your expertise, your commitment, and your passion. And thank you to my OIDP HIV team for your tireless efforts. They go 100+. And some EHE activities I would like to highlight at this time. We continue to support ONAP, Office of National HIV/AIDS Policy at the White House, in updating the HIV plan for its targeted re-release as the National HIV/AIDS Strategy on December 1st, 2021, World AIDS Day, this year in a few months. Also want to highlight America's HIV Epidemic Analysis Dashboard, what we call AHEAD. It's an online resource to monitor our collective progress in reaching our goal of ending the HIV epidemic in the United States. In September, HHS will also be adding social determinants of health to the dashboard, including homelessness, HIV stigma, poverty levels, and more. OIDP's EHE activities are extended to HHS regions 4, 6, and 9, through what we call our Prevention Through Active Community Engagement, our PACE program. And PACE has deployed uniformed public health service officers to support our EHE activities, and they include 36 of the 57 jurisdictions. Of course, these are just a few of the many activities underway across HHS to support implementation of the EHE initiative, and more how we found, and our work can be found on our hiv.gov website. So as we progress today, and I'm glad you're all here with us today, as you begin preparing your applications, I encourage you to take a moment to reflect. 2021 has been a really critical year, and we have been reminded of our history and our resiliency. On June 5th of this year, the US marked 40 years since the first 5 cases of what later would become known as AIDS were officially reported and described in CDC's Morbidity and Mortality Weekly Report, better known as the MMWR. We honored more than 32 million people who have died from AIDS-related illness in the United States and globally since the start of the HIV epidemic. The US government has declared its full commitment in working with a diverse group of partners to help end the HIV epidemic at home and abroad, especially in communities of people living with and at risk for HIV. We have made remarkable progress in preventing and treating HIV in the United States and around the world, but our work is not finished. Despite advances in HIV prevention and treatment tools, HIV disproportionately impacts men who have sex with men and African American, Hispanic, Latino, and American Indian and Alaska Native populations. We need continued collaborations from all sectors of our diverse society. We must also re-engage and coordinate with our community partners for maximum and enduring impact for everyone. I strongly believe that working together with intention, integrity, innovation, and inclusivity, we will get us to the end of this HIV epidemic in the United States. Thank you, Guillermo Collins and OMH for your partnership, and thank you all for our community partners for joining today. Now, I look forward to turning it over to Joya and Tim.
Thank you, Ms. Hayes, for your presentation. Welcome, everybody. Bill, can we get the next slide, please? This is our disclaimer statement. Tim and I will introduce myself while you have a chance to read it. Hi, my name is Joya Chaudhry. I am the Public Health Analyst with the HHS Office of Minority Health and the lead for OMH for the HIV Challenge. I am joined by my co-lead and my OIDP colleague, Dr. Timothy Harrison. Tim, I'll hand it off to you to introduce yourself.
Thank you, Joya. Good afternoon, everyone. This is again Timothy Harrison, Deputy Director for Strategic Initiatives in the Office of Infectious Disease and HIV/AIDS Policy. And I'm really thrilled to be here with my colleagues from OMH to talk about this wonderful challenge that we're embarking on. And special thanks to my boss, Acting Director Kay Hayes, for joining us and her really important remarks to help set the stage, as well as to Rear Admiral Collins for really providing us this opportunity with this challenge. So I look forward to talking about in more detail this challenge today, and then listening to any questions and thoughts from you guys listening. We appreciate you taking the time.
Great, thank you, Tim. Next slide, please. You've already received an overview of OMH and OIDP from our office directors. For the rest of the webinar, Tim and I will provide a high-level overview and timeline of the HIV challenge. including how to register, eligibility, and judging criteria. We will also address any questions you may have and additionally share resources towards the end of the presentation. All audio will remain muted throughout the webinar. We encourage you to use the chat feature for any questions or comments throughout the session. We hope that you'll have some patience with us as we're presenting, but we will definitely try to get to your questions at the end of the presentation. The recording of this session and the slides will be made available on challenge.gov website soon after the session. Next slide, please. This has been an exciting opportunity for OMH and OIDP. We've developed this national competition to identify innovative and effective approaches for community engagement and mobilization to reduce HIV stigma and improve PrEP and ART utilization among racial ethnic minority individuals who are at increased risk for HIV infection or are people with HIV. Approaches can include, for example, models, strategies, best practices, and/or tools. The goal is to identify successful, innovative, and effective approaches that can be scaled and replicated by communities at increased risk for HIV infection or are people with HIV for communities similarly impacted. An additional goal is to provide increased knowledge and skills for participants via coaching sessions, HHS learning sessions, access to resources, and an opportunity to build a community of practice among competition participants. Next slide, please. The total prize award is a total of $600,000 to 15 winners over 3 phases. Phase 1 is design of concept. Participants will develop concepts for community engagement strategies to reduce stigma related to HIV prevention and treatment within a specific target population. Up to 15 participants may be selected to each receive a prize of up to $20,000. This will span 2 months. The second phase is the development of approaches. Participants selected to receive a phase 1 prize, those 15, will create well-developed approaches for community engagement strategies to reduce stigma-related HIV prevention and treatment. Up to 7 submissions may be selected to receive a prize of $40,000. This will span 4 months. To support phase 2, OMH and OIDP will facilitate building of learning and community of competition participants, including individual and group sessions, provided to support the development of the approach, utilizing digital tools such as video conferencing, whiteboards to facilitate sharing among the group, and oversee a 3-session series, which provide training such as possible proposal writing support, how to access assessment of information and data, how to build an evaluation plan. In phase 3, which is a refinement of approach and small-scale testing, participants selected from phase 2 will participate, and up to 3 submissions may be selected. The winners may receive a prize of up to $60,000. Participants will test dissemination and uptake of their approaches at a small-scale community level to demonstrate how well the approaches are accessed by the population of focus, including considerations of social, cultural, and environmental factors that influence access to treatment and care. Competition participants will also demonstrate the acceptability, usefulness, and feasibility of their approaches. This will span 4 months. To support this phase, similar to phase 2, OMH and OIDP will facilitate building of a learning community among the participants, including group and individual sessions, and HHS series to provide training and increase skills. Next slide, please. Let's delve a little bit deeper into phase 1, since most participants will now register for that phase, which is, as we mentioned, is the design of concept, where participants would develop concepts for community engagement strategies to reduce stigma. Up to 15 submissions may be selected to receive a prize of $20,000. This will span 2 months with the submission deadline of September 23rd, 2021. Please keep that date in mind, and please register and submit your applications by this date. Submission requirements will include a written concept, 3 pages or less, supplemental video entries, 10 minutes or less. All submissions must be in English. Participants may not use HHS or other government logos or official seals in the submissions and must not otherwise give an appearance of federal government endorsement. And additional information on the criteria and submission requirements are found on hivchallenge.gov. Next slide, please. Challenge eligibility criteria. An individual or entity shall have registered to participate in the competition under the rules by OMH. So, as I mentioned, 2 steps. First, you must register by September 23rd, 2021, and follow these steps. Again, you can find these steps through the challenge.gov page for the HIV challenge. Please make sure that an official representative is identified and their information is included, in addition to a statement that they are affirming on behalf of themselves if they're an individual, or on behalf of the organization or a group of folks who are participating, that they submit this affirmation on behalf of. And more eligibility rules are again included in this link. You will have this link posted soon in the presentations. Next slide, please. Tim will now provide an overview of the judging criteria and what we were looking for in your submissions, timeline, and resources. Thanks, Tim.
Great. Thank you, Joya. Appreciate this opportunity to talk about our process for judging. A panel of judges will evaluate the submissions on the criteria identified below. Judges will be fair and impartial and may not have a personal or financial interest in or be an employee, officer, director, or agent of any entity that is a registered participant in the competition, and may not have a familial or financial relationship with an individual who is a registered contestant. Panel will make winner selections based upon the criteria outlined below and in compliance with the HHS competition judging guidelines. Entries not in compliance with the submission requirements outlined below will be ineligible for further review and prize award. The award approving official will be the Deputy Assistant Secretary for Minority Health. The Deputy Assistant Secretary for Minority Health will take into consideration the following additional factors: equitable geographic distribution of awards. Now let's look at some particulars. Next slide, please. Judging criteria. In the next few slides, we'll just highlight, some examples of criteria that the submissions will be evaluated on. Impact, up to 30 points. And this is, I'll just highlight a few of these things. You'll have all of these to examine, but including how well does the proposed solution fit local needs, resources, and values of the target population? To what extent is the proposed solution culturally and linguistically appropriate? How well does the project incorporate community engagement and mobilization strategies into the solution? In other words, involvement of priority population in the co-design and implementation of the strategy. And does the process and structure of the concept allow for all stakeholders to be heard and equally valued? And then how well does the project measure stigma reduction, PrEP, and art utilization? Next is innovation, up to 30 points. How innovative is the proposed solution in reducing stigma through community engagement, mobilization, and the community of focus? How innovative is the proposed solution in its ability to be tailored to culturally and linguistically diverse audiences, including users with low health literacy or limited English language proficiency? Next slide, please. Accessibility. How accessible is the proposed solution to the population of focus? Community members, targeted racial and ethnic groups, racial and ethnic minority individuals, etc. And will the program reach the intended audience inclusive of the diversity within the population. Sustainability. How well does this proposed innovation have the ability to continue beyond the end of the competition? Can the proposed solution be scaled up and adapted in other communities if proven effective? Next slide. What are we looking for? Your submission should include a one-paragraph executive summary that clearly identifies the innovative approach and describes how it will use community engagement and mobilization strategies to reduce stigma and improve utilization of PrEP and ART among racial and ethnic minority individuals or persons with HIV or at increased risk for HIV infection. A description of how the approach will potentially affect racial and ethnic minority groups, specific subgroups within those populations, and other interested stakeholders as identified. A description of how the approach is innovative in targeting gaps, barriers, and accessible across social, cultural, and environmental factors that influence HIV treatment and care. A description of how the project would utilize community engagement and mobilization strategies specific to the target population in the proposed approach. A description of how people from the priority population are involved in the co-design and implementation of the strategy. A description of the proposed goals and major objectives. A description of the proposed measures used to assess stigma reduction, PrEP, and AR2 utilization. And more detailed information are available on challenge.gov. Next slide. This is the timeline. We are currently in phase 1, which began on July 26th with release of the announcement. The submissions, as has been pointed out, are due September 23rd. And we will turn to phase 2 beginning in November 1st of this year, and that will continue until March 3rd of 2022. And then our phase 3 will begin in March of next year and continue into the summer of July 14th of next year. Next slide. These are just a couple of pages we thought we'd pull together. I won't read all of these, but there's some resources and organizations and other items of interest that you might find useful as you prepare your challenge project. Variety of federal resources, examples, case studies, all of that here on the next couple of pages. Next slide. Yes, and these are a continuation of various resources that I think would be useful as you consider. Next slide. I'll now turn it back over to Joya.
Thank you, Tim. So if there's anything you take away from this webinar, it's this information. There are 2 steps to be completed by September 23rd. And one of the questions that popped up today in the chat are there 2 separate emails. Yes, one for registration and one for the submission of the actual concept. So make sure there's detailed instructions. I provided the link on the actual page, on the actual chat, and you'll also have it in the slides. But there's also a submission checklist that OMH developed, and it's on the OMH HIV challenge page. And I'll copy paste this into the chat so you all have that as well and can access that. Come join us on our journey to engage communities to reduce HIV-related stigma and increase prevention and treatment among racial and ethnic minority people. We encourage you to not only submit your ideas and take part in this challenge, but also to spread the word with your networks and communities to achieve the ultimate goal of reducing disparities in utilization of ART and PrEP. Next slide, please. For more information on the challenge and OMH, please refer to these resources. Next slide, please. we'll go to questions now. I've already received some great questions, so I'll go ahead and go over those a little bit, even though I've provided the responses here so everybody can hear them. And please feel free to type in more questions. We'll try our best to get to all of them and respond to all of them. We'll also post these questions on the website or on challenge on the HIV challenge page, so everybody has access to them and you can reutilize them whenever you want. So some of the questions we received is, may funds be used to provide incentives such as prizes to partners and participants? So the answer is the challenge rules do not contain requirements for how the prize money should be spent, except the instructions found on the challenge page. In the prizes section that state, the winners are expected to present their project findings and participate in post-award activities within 6 months after the end of the competition. This presentation may be virtual or in person, and prize funds are expected to be used to facilitate this presentation. Next question. Can I apply with an existing program? While the submission requirements for this challenge allows for the use of an existing solution, as a part of the participant's entry, there still needs to be a clear innovation. Solvers will need to show they did not simply apply an existing solution without its modification, enhancement, or augmentation. The purpose of the challenge is to drive innovation. So there has to be clearly innovative offering in your submission for it to successfully compete. Next question we had received was about the two-step process. Yes, there's 2 emails again, one for registration and one to submit the concept. There's specific information that we're asking for each of these emails. Please go, each of these processes. You can find that detail on the challenge page. And if you have any questions, please go ahead and send any emails or questions to hivchallenge@hhs.gov. Those were the ones I had noticed. Let me go through really quickly to see what other questions we have. The submission video. There was a question about the YouTube video. So we're asking that it be posted as an unlisted video and then emailed to us. Only subject matter experts and judges and only those staff involved in the HIV challenge will have access to those videos. Other staff will not have access to any of your information, any of your submissions or video or written submissions. Only approved HIV staff will be on those. Could the project focus on PrEP or R, or does it need to address both? So we're looking for utilization, addressing disparities, and you could do either. It doesn't have to be both. And Tim, I'll open it up to you as well to expand on that answer if you have anything to add.
No, absolutely, you're absolutely right. It does not need to be both. There are certain aspects where there might be a particular interest in PrEP utilization, say among gay Latino men or Black gay men or whatever. You can absolutely narrow your focus. So no, the short answer is no. It does not have to be both.
Great, thank you. And I would again encourage you to go back to the challenge and really look at the judging criterias. You'll notice that our judging criterias are much more expansive than some of the other challenges. And we wanted to make sure that you really understood what the judges
Joya, we just lost your audio.
Okay, can you hear me now?
There you are, yes.
Apologies, technology issues.
Yeah, it's
So
been
officially,
about 20 seconds or so.
okay, sorry about that. I was trying to fix that. So video entry information, both written and video entry that you need to submit. If this is a bilingual challenge, why can't we submit a video in Spanish? So we are super proud of the fact that we were able to provide this challenge in Spanish. Unfortunately, because of resource allocations, we are requiring that all entries are in English. So, but we are trying to, we are trying to offer this webinar and the written notes in Spanish as well. So as much as we can, we're trying to provide those products. How is the determination of the prize money made? So basically, as we had talked about, all of the judges will be critiquing your submissions. For phase 1, there will be 15 winners chosen. For phase 2, there will be 7, and phase 3, there will be 3. So if you are those 15, you will get up to $20,000. And then those 7 in phase 2 will win up to $40,000, and then the final 3 will win up to $60,000. To whom do we direct queries during these phases? You can submit questions to hivchallenge@hhs.gov, and I'll type that in right now. That's our email resource box that we check regularly. So you can send in any questions to that. Does the proposed community engagement strategy need to be limited to one jurisdiction area, or can it span multiple states and cities? So as you see in our challenge, we're really trying to get into specific communities, so engagement of communities. But our challenge is about finding innovative ideas or approaches that we can then scale while sustaining that program. So I would encourage you to submit your ideas. It does not disqualify you if your engagement strategy is to cross multiple states or cities. But again, I would take a look at those specific requirements of community engagement, specific communities, especially high risk communities for HIV, racial ethnic communities. So there are some specific areas that we are trying to target within the challenge itself. Tim, did you have anything to add to that one?
No, I think you're right. I don't think it should disqualify you, but we are looking for certainly the ways in which these initiatives will have some impact among the communities that are being represented. And if it's a multi-jurisdiction area that you think will have some impact, I think that's fair. But we'll leave that to your judgment in terms of how you frame the project.
Great, thank you, Tim. When are funds awarded? So right after the winners are selected, phase 1, because of the uncertainty of the number of applications that we'll have, judging may take about a month or so, a little bit longer. And so once the winners are selected, it goes through our processes through the Program Support Center to process the funds. Unfortunately, we don't have an exact timeline, but we're hoping to get it in the hands of the winners as soon as possible. But there are some processes that we do have to follow. Is a video required? As I had mentioned, yes, videos are required. Are there reporting requirements once funds are received and used? No, this is not a grant or a contract. This is what makes the challenge different. You have your specific submissions that you submit to us, which are then critiqued based on the judging criteria, and winners are selected from those criteria, and then funds are transferred. As we mentioned, we hope that the winners, we expect that the winners will present on their innovative approaches to OMH or other federal government possible conferences or presentations up to 6 months after the challenge is actually completed. Sorry, I'm just going to go through a couple more questions. Can such projects be funded in Central Africa, precisely in Cameroon? No, this challenge is specifically for the United States of America, so within the US. But as we had mentioned, if there are projects that are in other countries that have been successfully implemented, you could use part of those ideas or strategies if it would work within the communities in the US with your specific community. Tim, do you have anything to add to that specific question?
No, I think that's right. Certainly leveraging from a variety of different places the resources, experiences that have really produced strong anti-stigma efforts, I think was worthwhile, including in any project that you might want to put forth. So, but this is a specifically U.S. Based project.
Yes. So if working in a team, can prize money be split at a winning team's discretion? Yes. So the funds, this is not, again, a contract or a grant. The government does not in any way direct how you use funds, except that one piece where you have to allot funds to come present if you are the winner. Other than that, you can utilize the funds as you please. And some folks may choose to put it back into their projects. Will we need to include a budget in our proposal as well as appendix for reference? So we did not include a requirement to include a budget, but that never hurts at all. A budget is always helpful in sort of reinforcing your ideas and your approaches, but that is not a requirement in the submission requirements that we have. Can the video be included in Spanish? So all submissions need to be in English, both written and in video. What are you looking for in a video submission? So the video submission actually was a great suggestion to us from the challenge.gov folks. And we really want to get the essence of the team members in the video and also your approach. Not a lot of things come out in written proposals. So the video is really, we are going to review both. We will review both your written proposal and the video. So the video is more of a supplemental submission to reinforce your written submission. So if there's something that you really thought was really important or really excited about the project, want to highlight it, that's something that you could definitely do in the video and to supplement your written submission. Can you please discuss the eligibility of organizations that previously received NIH fund for research? So this is specifically discussed in the challenge criteria, but I'll go over it really quick. It really depends. So federal grantees may not use federal funds to develop their challenge submissions unless use of such funds is consistent with the purpose of their grant award and specifically requested to do so due to the challenge design as described in this announcement. Federal grantees who use federal funds to develop their challenge submissions must also obtain written prior approval from the appropriate grants management or program officer and provide documentation of prior approval upon request by HHS. So as you can see, a lot of the theme of the challenge is a separation of any concept of any federal influence over the challenge. So federal employees, especially HHS employees, are not allowed to participate in the challenge either in personal or in professional capacity. You are not allowed to use these funds, as I specifically said, within your grants unless you get special permission. There are some exceptions. So there are some rules. I would really encourage you to go back and read the eligibility criteria in detail and submit any other additional questions that are specific to you and to the HIV challenge at hhs.gov, and we can address those questions. What format is to be used? So citations, abstract format. We did not identify any specific format for you. You'll see we did say, font 11, PDF, those kinds of things. But, as clear as possible, our guidance is look at the judging criteria. Be very clear about how you're addressing those questions in the judging criteria. Those are specifically there, and that's what the judges will score you on. So just make sure that you address the questions that are on that criteria and are very clear about how you are addressing them. So there's another question. There's no request for budget. So how does the award amount get determined up to $20,000? So you do not have to use these funds towards your challenge or your innovation or your approach. The challenge structure, the $20,000 for the first phase is a prize award for the group for the 15 winners that we thought had the best prize. Some winners may choose to put the funds back into their challenge, but some may not. So we do not direct that at all from the federal government. Do you think a small policy fix would be appropriate for this challenge? Because we can't really implement that through our own efforts. Again, this is an approach. We do not identify what those approaches are. Please go ahead and submit your idea, your innovation, if it's an innovative policy that may impact practice, that it may impact approaches to strategies in addressing HIV stigma, then it doesn't disqualify you. So please go ahead and submit the idea and we'll score it based on, again, those judging criteria that are listed on the challenge page. Do we need to include citations and evidence in our proposals? Yes, citations are always encouraged. That would be great. We do not specifically identify it in the challenge criteria, but anywhere you can provide citation is always important. Are winners able to win more than one phase? Yes, so this is a structured challenge. So only phase 1 winners can go to phase 2 winners, can go to phase 2. And only phase 2 winners can go to phase 3. So anybody who didn't win phase 1 can't go further. If you did not win phase 1, you cannot go further. So only those 15 winners that are in phase 1 will go on to phase 2 and phase 3. Because of the structure of how we've built the challenge, where you first design the concept, you then develop the proposal, and then you think about small scale testing and sustainability and spread. So I think a couple of questions were related to the phase winning. Are we able to partner with other community-based organizations? Yes, we encourage partnership. Anywhere where you can, our goal, as you can see, we've really highlighted the community engagement. Okay, I'm back. I apologize. My computer decided to act up during this presentation. In phase 2 for winners of phase 1 to participate, each phase is connected to the previous phase. Yes, correct. A question. So the base of the prize amounts were basically our estimate of what we thought were a fair prize for the phases that we're asking for. So it was determined in a very systematic way, and these are the amounts that HHS has decided that the prizes were set. So there was a question about how were the amounts set. Sorry, I'm gonna just go through some of the questions. Does HHS prefer a specific style of citation? And no, we do not, as I had mentioned before. I represent a faith-based organization. Our 501c3 is designated required. No, they are not. So you can be an independent entity or organization that can participate. So please go ahead and read the eligibility requirements. But I believe the answer to that is no, that does not disqualify you if you are not designated as a 501c3. How do we accept experts? So the experts come in phase 2 and 3. So the 15 winners that go on to phase 2 and the 7 winners that go on to phase 3, OMH and OIDP have identified experts in the field. We've also identified judges, and they will be assigned to you, whoever gets to phase 2 and phase 3. Okay. Well, some of these questions I'll have to get back to you on because I don't have the answers to them, and that's why I've sort of skipped them over. But I promise you, we will review these questions. We will get those answers up in an FAQ so everybody has access to them. Okay. So again, thank you so much for attending this session. We are super excited, as we mentioned, about this challenge. For any additional questions or follow-up, again, please contact hivchallenge@hhs.gov. We will try to have this recording and the slides for this session up soon. And additionally, please remember 2 steps if you're interested in this challenge. One is to register and one is to submit the concept, and both by September 23rd, 2021. Thank you again, and we look forward to hearing from you.